Ashley, thank you. Physician suicide has been a mental health crisis long before the pandemic. Doctors have one of the highest suicide rates of any profession. This Saturday, September 17th, is National Physician Suicide Awareness Day. And joining us today to talk about warning signs and support for those in need is the Director of Well-Being at Hartford Healthcare, Dr. Jennifer Ferrand. Doctor, thank you for being here. Appreciate it.
Thank you.
It has been a couple of really difficult years for everybody, specifically folks in the medical field from this pandemic. How hard how much has COVID played a role in physicians' well-being in the last couple of years?
Well, you know, the pandemic heightened stressors that healthcare professionals were already dealing with, and also introduced new ones related to really profound losses from COVID, the expectations and the pace of our work, and our inability to take the time and space that we've needed to heal. And so this together really creates a sense of urgency to better support the mental health and well-being of physicians and all healthcare workers.
So if you have a medical professional in your life, what are the warning signs to look out for?
There's a national campaign for physician suicide prevention called Vital Signs, and the campaign tells us that we can remember suicide warning signs by the acronym HEART. So we're looking for changes in somebody's health, their emotions, their attitude, their relationships, and lastly, their temperament, which means day-to-day behaviors.
All right, and how does Hartford Healthcare respond and provide support for its many medical professionals?
So ultimately, we want to prevent difficulties from becoming emergencies. And so to do that, we focus on a few things. We want to remove barriers to help seeking by making sure people know where to go for help, making these resources easily accessible to all people, and giving people permission and support to care for themselves and others. We also do a lot of training and education. We want to make sure people know how to identify distress or needs for support in themselves and their peers. And we want people to be unafraid of asking somebody directly if they're thinking about suicide and feel confident in their ability to help somebody in need.
Okay, and what are some of the resources that are out there now for those who are seeking help?
So if someone's in immediate need of urgent help, 988 is the new 3-digit national number for mental health support. And in Connecticut, you can still call 211 and get to the same place, which is the National Suicide Prevention Lifeline. This is who you'd call for somebody in crisis, but also for less urgent mental health needs or information about resources. People should still call 911 for police or if somebody needs immediate medical attention.
Right. And we have the website at the bottom of the screen there. You saw hhcbehavioralhealth.org. We'll link you there from our site at WTNH.com as well. Dr. Jennifer Ferrand, Director of Well-Being at Hartford Healthcare. We appreciate your time. Have a great rest of your day.
Thank you so much.